Here are some of the latest headlines of the COVID-19 outbreak. Vice President Mike Pence will be touring Rochester's Mayo Clinic this afternoon, learning about a new coronavirus testing partnership. Governor Tim Walz will be joining the vice president. They plan on talking about the state's partnership with Mayo and University of Minnesota to expand testing for COVID-19. Partnership expected to boost the state's capacity to 20,000 tests a day. Pence's visit comes a day after President Trump announced new guidelines for expanded testing and tracing. Members of the president's coronavirus task force say next month the country will be capable of testing 8 million people. Since the pandemic began, the U.S. has tested 5.4 million people, so this would increase production by quite a bit. Private companies, key in making this possible, heard until this point that we've had the blueprint to test more people. We just didn't have the supplies. We didn't have enough stuff. We didn't have the swabs. We didn't have the other testing materials. And manufacturers have started increasing that. Mayo Clinic, for example, has started making swabs for its own test. Also in this partnership, pharmacies like Walgreens and CVS working to make the test accessible.
We now have a capacity to test about 35,000 individuals each week. And this afternoon, we announced plans to expand that capacity even further. Beginning in May, we will install testing capabilities in up to 1,000 CVS pharmacies.
They're going to do that by using drive-throughs at those pharmacies, parking lots, too, as testing sites. Should expect to see that rolled out sometime in May. Same goes for Walgreens. Walmart says it's going to open testing at 100 locations by the end of May.
COVID-19 has now claimed more lives in Minnesota than in Wisconsin. Wisconsin reported its first deaths just 2 days before Minnesota. Wisconsin's death toll then soared ahead of Minnesota's for about a month. Minnesota's deaths started rising swiftly about a week and a half ago. Now 286 people have died in Minnesota and 281 have died in Wisconsin. Now, Wisconsin still has a few thousand more known cases of COVID-19 than Minnesota. The Minnesota Department of Health says that Minnesota's death rate may be higher because we here in this state focused on testing people in long-term care facilities, which is where 78% of Minnesota's deaths have happened. 2 of those people lived at a Wayzata assisted living facility. They had to evacuate everyone just over a week ago, and we're now learning that they will not be reopening. The majority of their staff has gotten sick and they couldn't do their jobs. 21 of the 59 people living there also tested positive for COVID-19.
Frustration growing for some parents as they try to navigate the world of distance learning, but at a severe handicap here. A digital divide, keeping their kids from accessing the tools needed to complete their assignments at home, like Wi-Fi or computers. Look at this information from MPS in Minneapolis. More than 2,700 people waiting for a device, 3,600 students, no access to Wi-Fi. A school board member says it all boils down to funding issues that run deep.
If we would have been fully funding our schools, that would have been an extra $54 million we would have had, that we could have used to utilize for computers for every child to have.
Other school board members say this is a state issue because it was the state who ordered distance learning.